Arthrosamid is a new treatment that we brought over from Copenhagen. It is a new hydrogel treatment that has been very useful for patients suffering from knee pain, and specifically with knee osteoarthritis. So Arthrosamid treatment is not just for elite athletes. It's for patients suffering from knee pain. It works very differently to any other injection currently on the market. It works on a slightly different side of the joint. It works on the synovium, which is the lining of the joint, instead of in the joint itself on the cartilage. It is a brilliant treatment for patients that got knee pain with osteoarthritis, and certainly it's not just for the athlete. So typically I will screen the patient and I will talk to them and I do clinical examination. After that, we will do an MRI scan to look at the condition within the knee. They are very different, depends on the stages of the arthritis. That we treat patients that with early stage arthritis, we call it grade 1. We also treat patients with what we call bone-on-bone osteoarthritis within the joint, that's grade 4. Of course, the result of grade 1 and grade 4 will be very different. However, interestingly, with some of my research, I have noticed it works very well on even grade 4 osteoarthritis. And I think because the mechanism of action is slightly different, it's not working on the cartilage and bone, but working on the synovium. So on a slightly higher grade arthritis patient, it do actually still work. So pain relief is the most important benefit. And the hydrogel is not a regeneration injection. It does not regrow your cartilage. It does not turn you back to 25 years old again. But what it actually does is take the pain away, allow you to carry on function, carry on with daily living, and do whatever you need to do. So that's the main benefit of using the hydrogel. And at the same time, it is a non-biodegradable substance, which means that it stays in the joint for some time. And actually, the effect has been very promising and has lasted quite well. There is good study coming from Denmark to suggest that we got good 2 years data, and I'm sure we'll can't wait for our 3rd year data as well. Personally, in treating osteoarthritis of the knee, patients are very happy and the pain tends to go away, and that has been something that is very different compared to other type of injection that we use so far. So after any injection or after any treatment, we tend to advise any patients to try to take it easy for the next few days. So usually my advice would be for the first week, continue taking anti-inflammatories such as ibuprofen to try to reduce the effect of inflammation within the joint. At the end of the day, although it's a minimally invasive procedure, which is just involve an injection into the joint, we still been into the joint and can cause a little bit of acute inflammation. So we want to enhance the effect of this hydrogel by actually resting that knee for a little bit. Usually after 7 days to 10 days, patient can resume back to normal activity. So certainly I wouldn't suggest going to run a marathon, for the first couple of weeks. So everybody is different. We are all biological beings, and therefore the way that how the body responds to these molecules, to this injection are very different. So from experience, some patients are very lucky. From day 1, it works. During the injection, I will use some local anesthetic to numb the joint. I have some feedback from some of the patients that from the moment that the injection being gone in, they are out of pain from the beginning. Some patients are not so lucky. It takes a little bit longer before it kicks in. So typically, it takes approximately 2 weeks before the Arthrosamid kicked in. Certainly by week 4, we'll see some result. And however, there are some patients that we do not see any result at week 4, then unfortunately for those patients, we say that the Arthrosamid has not worked for them. It is a treatment that is very useful, but it is not a magical treatment that works for everybody. So it is something that we have to bear in mind when we do this injection. It's got a good chance to work, but it is again something that we need to be cautious about. It is not something that we can inject into the knee and then it will be completely fine. But generously speaking, it takes a couple of weeks before it kicks in. By week 4, it will have the most effect, but some patients are very lucky, work from the set go.